O heavenly King, the comforter, the Spirit of truth, who art everywhere present and fillest all things, treasury of blessings, and giver of life, come and abide in us, and cleanse us from every impurity, and save our souls, O good one. So we're here this evening, and we have Polycarp Craig Anderson, who is an Orthodox subdeacon and an epidemiologist. Yes. And you have a degree in epidemiology, or is it two?
I have a PhD in epidemiology from UCLA.
Okay, and Dr. Marquelle Klooster Anderson, who is a doctor at Loma University Hospital in pediatric gastroenterology.
Kids' tummy doctor.
Kids' tummy doctor. It's very important that kids have tummy doctors.
Yeah, very much so.
We're to have a light enough evening discussion on the current health crisis. And the first thing I wanted to ask you is, like, do you feel that this is a health crisis?
Yes.
Yes, I think it definitely is.
So, how do you compare it to health crises? You remember things in the past, some of them at least, epidemiological events you've seen.
Well, I remember the '69 flu epidemic. There was a bigger one in the '50s, but I was rather small then.
Mm-hmm. Okay. But you've studied these.
Yes.
Yeah, I won't, it's an absolutely fascinating thing that you described once, the epidemiology of things spreading through aerosols via pipes in Hong Kong. But that's quite a subject,
Yes.
So we'll skip over it because, as you said, it was quite gross and fascinating to say that that's how you introduced the subject, and that's exactly as it was. One of the things that I remember you mentioning recently was you were saying that people say this is just the flu, and you said the government spends
billions of dollars trying to prevent this flu.
every year.
Every year, yeah.
And what do they do with that?
They're tracking the flu, developing immunizations, convincing us to get our immunizations.
Okay.
And a great deal of research on the viruses and the effects of the flu. So the flu isn't a minor thing.
No, the flu isn't
The flu isn't a big deal, and when there's a big shift in the flu, then we can get more cases and more severe cases.
Mm-hmm. And a severe year for the flu is how many deaths?
I was going to review all the numbers. I think a typical year is about 40,000 deaths, and a severe year would be maybe 80,000 deaths.
Okay. Can you think of any year we've had 80,000 deaths from the flu recently?
There's been one really bad year in the last 10, which approached that.
Mm-hmm. Yeah. But we've zoomed right past that in any case.
Yes.
Have you had much of an intake in Loma Linda?
I know that as of today, we have 70 adults
70 adults.
admitted to the hospital. At the moment, we only have 8 children, but we've had as many as up to 12 or 13.
12 or 13 children who are sick.
Children, yes.
Now, one thing which I've heard is that children tend not to get as sick as adults.
Well, that may be true for a higher percentage of children than what we see in adults, but we have had deaths in pediatric patients at Loma Linda.
Oh, at Loma Linda.
Yes.
Okay.
And one of the points I would make on this is that one of the patients who did die from consequences of COVID-19 at Loma Linda was described as being perfectly healthy, but he was obese.
Oh,
And I think we underestimate the role of obesity in affecting the outcome of this disease, both in children and adults.
Okay, okay. And now we most of us have heard that outcomes are worse for people with any pre-existing conditions, obesity, diabetes, any
Heart conditions.
heart conditions. Yeah,
Pulmonary.
Of course, we would expect lung conditions, but it's
Yeah.
heart conditions as well.
So, you know, I mean, in there's only like so much that I'm sort of willing to, even I would even say able to expend time on, you know, but I mean, I have had people compare these things and say it's not really worse than.
But it keeps getting worse.
Yeah, okay, yeah.
We have, the number today is about 140,000 deaths. But we're not done, we're not anywhere near done.
Yeah.
And this was over a period of 5 months, at the most, 4
Yeah.
months, 4 to 5 months.
Yeah, there's something, maybe when I post this, I'll put it in the description box, but it was actually an explanation in New York, which graphically illustrated this by showing the deaths in New York from flu, from traffic, from all sorts of things. The traffic one was evenly distributed. They just took the number of traffic deaths and evenly distributed it without spikes for Memorial Day or Labor Day or whatever traffic things spike, or the time changes, those that we still inflict upon ourselves. They didn't have, it was just distributed evenly as if they happened evenly, but the other ones, the flu and other ones, were seasonally variant. And then you saw the when they first published it, and it was a very interesting thing because the when you would look at it again, the charts would be updated. I haven't looked at it in a while, but it did explain some of the differences. The charts would be updated, but you could link then to the chart as it was when the article was originally published, but you could also see where the data was now. And so, you know, there was something a little hopeful in that. It was a while ago, but it was in New York, but it just showed that the spike of COVID deaths had gone way above all the other forms of death. At the last time I looked at it, it had also started to go down. Though when I last looked, I'm sure it's decreased since then, and it's been a while, but when I last looked, it had started to decrease, but it was still above every other cause of death. So it was above flu deaths, it was above for traffic deaths, it was above every other kind of death in the period. And of course, we know that the number of deaths that it's caused in California, which is somewhere over 7,000, reported 7,000 today, is in 4 months well above our traffic deaths for the year, well above our usual flu deaths for the year, and so forth. I mean, I think, you know, I think that, you know, one thing that tends to concern some people is that they feel that there's political manipulation, and the reason they feel this is because there are always people that are trying to see how any event in our country will work out politically. Such people exist in both major parties and even some of the smaller ones, I suppose, if they can scrape enough money together. But despite that, you know, the thing we're going through is not primarily a political event. It's primarily a health event.
Well, and it bothers me that we see everything through a political focus. I'd like to see our country get back to the point where we actually care about the health of the citizens, about what policy is best for the country, and not simply what benefits one side or the other.
I mean, all three of us are Orthodox Christians and have been for some time, but we've also been Americans all our lives. I don't think any of us would postulate that there's any kind of Christian engagement with the political life, which is, politics is the life of the polis, the life of the community, the life of the polity. There's no engagement with that without some concept of the common good, there's no engagement without a sense of the life of the common good. And I just look back, and there's plenty of blame to spread around, but I look back at what was expected when I was growing up, what we expected of each other as parts of a community, and where we are now, and I could almost cry. Now, for those of you that don't know, these are not only friends of mine, but they're my in-laws. So, so it shouldn't be offensive if I say, you are older than I am. Your in-laws should be older than you are, but so you will remember decades before I was conscious. But I mean, there was, I think, a constant stream of a sense that there was a common good, and Christians. We came from very different places, as we were just talking about. We have all converted to Orthodoxy at various points, but we always were looking at the idea that it was pious or devout to believe in the common good, as it is to and that there was an interplay, an overlap. Maybe sometimes in this country we had too much of an overlap, but an overlap between patriotism and piety. But Saint Nikolai of Japan, taught that patriotism is grounded in the commandment to love your neighbor. So, you live with all these people, you work with them, you do business with them, and so, so you have to care about them. And he taught the Japanese that, and he taught that with some personal suffering, because he taught that most clearly during the Russo-Japanese War, when he told the Japanese Orthodox that they were to pray for the emperor and his victory in the Russo-Japanese War. And being at that time still a subject of the Russian Empire, he then withdrew from public worship and prayed in his cell. Now, moving, I mentioned to you earlier that I was happy to find a copy available to myself of the book by John Adams, but one of the things that struck me was that, of course, we like to think that we moderns have so totally transcended plagues, and we're in for a surprise! Technology doesn't solve all of our problems, and put not your trust in princes. However, they did occur with greater frequency, and one of the things that struck me is that people were practicing social distancing in early America when the plague hit. I haven't gotten through so much of the book, but there was a yellow fever in Philadelphia. And of course, one of the things that people did when there was a plague was they would leave the city if they could. And the other thing was that they of course they didn't know. And this is something, it is quite true that for Orthodox Christians, we do not adopt an attitude that, we know so much more than the saints who went before. We know, like people, but I think that that's, it would be foolish for somebody to say that they understand theology better than St. Gregory the theologian because they were able to go to a modern seminary or something. On the other hand, we know more about viruses than the saints in the past did. Every one of us. I mean, during the 1918 epidemic, people didn't even know what viruses were. I mean, I didn't study this myself until the current thing, but to see that viruses were not really isolated and understood what they were until after that last epidemic. Another example of the social distancing that, of course, they didn't use that word, but in the plague village, there's a village which had a strict quarantine for a year due to bubonic plague. Let me just say something about coming from New Mexico. They just put something that there was a squirrel with bubonic plague in Colorado, and I grew up in New Mexico, and bubonic plague is not, rodents with bubonic plague occur in the Rocky Mountains every year, and sometimes they kill people. Most of the time, fortunately, they don't, particularly if they're diagnosed properly. Though a relative by marriage died because she wasn't diagnosed in time. So people do die of bubonic plague, but fortunately, we don't die of that the way we used to, because there's good treatment and so forth if it's diagnosed. So if you saw that report that there was a squirrel with bubonic plague in Colorado, don't head for the hills. We do so, but this one village, they had a terrible outbreak of the plague, and they had church services in a sort of hollow where the stones had natural acoustics, and they didn't come close to each other. They would go there, and I imagine the parson would read the prayer book and preach. I don't know if he attempted to administer the Holy Communion under such circumstances, but the people did figure out some of these things before the modern age. I would like to move to a faith issue before we go on to a couple of things we talked about earlier, and that is that we do not not meaning to put down any sort of group, but I remember what your late father, Grandpa Charles, used to say about Christian Science. He didn't agree with either adjective. But we're not that. We don't. It has not been our way to. That's not been our way of dealing with troubles in the world. And I want to say that it is not a Christian obligation. And if you think about this in your whole life as a Christian, you were never taught this, because it would be silly if somebody said so. But it's not our. We're not ever given by Christ. Except for one little weird group. Christ gave us the promise that nothing could harm us without His will. And He says that at the end of Mark's Gospel in the long ending, the origin of which is not our subject. So, but there's those people that actually decide that they're going to pick up snakes because it says you can pick up snakes. Now, the Scripture teaches us, and we believe that the Apostle Paul was kept safe from a snake bite, but he didn't go looking for it, right? And so I would like to say, we trust in God, but we take precautions in life. We trust in God, but we see doctors. You have both lived in medical life your whole life as believing Christians and as educated people in the medical field. And but I feel that there's something which is not quite faith. It's perhaps an infiltration of magic thinking when we say that icons are miraculous. One website regrettably took reference and said the only church in the Chernobyl region that's open is has lower radiation than all the other areas, and that this is proof that viruses don't come in church. Well, the reason why I checked up on that church with my friend Father Nazari, who's from Ukraine, and he told me the church was recently built. Now, I would have a hard time locating this, but I remember very distinctively seeing churches being closed in the immediate aftermath of Chernobyl. Churches that were so open, and by that point, perestroika and glasnost were in full swing. The Soviet state was no longer in the business of closing churches, but they were coming into churches which were so open there were still candles burning on the candle stands, and when they came in with the counters, the brass of the candle stands was just. Father, and I also saw it at some point. It was quite a while ago, so I wouldn't have any idea where to begin looking for this. But I saw on some documentary of the end of the Soviet Union or something, a whole room in Kiev a vault where they locked up icons that had been taken from that had been because the gold foil that was attached to the icon in the final stage of painting was radioactive and will be for the foreseeable future. And I thought of those icons when you told me recently, Marquelle, that you had several children that were born with syphilis. I had the same visceral reaction, which is that there's a blasphemy here. There's a blasphemy. We should not act in such a way that we irradiate icons. We should not act in such a way that we infect children with venereal diseases. These are, nevertheless, we don't. One story Father Nazari did tell me was that there was a wonder-working icon, and it was considered wonder-working because of all the churches, of all the icons in the church where it was, this one icon of the Theotokos did not become irradiated in the aftermath of Chernobyl. And I know that when our church burned in 1969, one of our icons did not burn, and we keep it special, even though it's just a print decoupaged onto a board. And the same thing happened. I don't know if it was a decoupage. I think it was a painted icon. But the church burned in West Sacramento recently. There was one icon of the Theotokos that wasn't burned, though everything around it was burnt. And that happened early in the ministry of Father George Sondergaard, my old pastor in New Mexico, who had one icon of the Nativity of Christ that didn't burn when their mission burned, the first Orthodox or OCA mission in Houston, I think it was, North Texas. But he kept that, and I think they still have it at the church in Albuquerque. But we know that fires burn in churches. We know that, particularly at the current time when the memory of 1453 is sort of being rubbed into our consciousness, we know that invading armies can harm people in church. Just a couple of, I don't know how many years ago it was, but there was a madman who attacked the cathedral somewhere in the far east, maybe it was Sakhalin Island, and he came to church right after liturgy on Sunday and started shooting the gun there. We know bullets work in church. It is not extra Orthodox or extra faithful to believe that because we don't see with the naked eye viruses or radiation in Chernobyl, that therefore they won't hurt us. Whereas we know that things we can see, like fires and bullets and invading armies, can hurt us in church. But, now this is not to say that, well, then what is the church for? I can remember very distinctly Matушka Margarita telling me about being in church during Molebens with the Proclusus Canon and Akathis every night in Tallinn during the Second World War when there were bombings. And the decision that some people made to remain in the temple and not go to a bomb shelter. And what it meant to them at the time, and that once it was she was just going up into the church and the siren went off and she decided she was going to go up into the church anyway. And the priest, who had never done something like this before, who had always he'd actually come out of the Soviet Union when Estonia was part of the Soviet Union, and had remained there. And he opened the curtain and the royal doors to begin the service, and he said, "Everyone stay here." And he looked radiant and bold. And after his time in the Soviet Union, when they first met him, he seemed cowed and silent. And he said, radiantly and bold, he said, "The Mother of God is going to keep us safe here." And Matушka Margarita told me he looked like a prophet as he said that. And I also know that Father John Reinhold, who was in his life an adornment of Orthodoxy in Southern California, was when he was leaving Estonia, he was caught in an incendiary bomb attack, and he wrapped himself and his Matушka up in his vestments, and under his vestments he was safe. These things are wonderful, and they give us a great deal of hope, but nevertheless, we have entire books of the Bible like Job and many Psalms to remind us that God sometimes does that for us and sometimes he doesn't. And we can't always understand, and that's what God says to Job is you can't understand all of my reasons. But, you know, just seeing God and being in a relationship with the living God is enough for Job. It is enough for Job. And, you know, and when it's properly translated, you know, Job abases himself before the majesty of God, but most of our English translations have him recant, asking the question. But that's not in either Greek or Hebrew that he recants. He says, now you know, I'm not asking anymore, now mine eyes have seen. But it wouldn't make any sense to say he recants, because, you know, immediately God says, you know, Job has spoken rightfully, and all the people that thought they had tidy explanations for how I acted, and he will be their priest and make intercession for them. And that's how Job becomes a type of Christ. So Job's question is not even really, I think, reproved in the scripture. But you know, sometimes trials and tribulations come upon us, and sometimes they don't.